All new tonight at 6, a woman battling this war on the front line is coming forward, claiming that Catholic Health is putting its employees' health at risk. She tells our I-Team Chief Investigator Charlie Speck there are just not enough things and there's not enough equipment to protect everybody.
I have coworkers that, believe me, I cry constantly at night thinking which one of my coworkers are going to die next. So they're terrified. I'm terrified.
We've changed her voice to protect her identity. That voice is from a nurse at Mercy Hospital.
There's a lot of deaths going on, Charlie.
She's a frontline worker on the fight against COVID-19 in Erie County, where 8 people have died from the virus.
Everybody's getting exposed to, they're not doing tests.
And she says Catholic Health isn't equipping her with the protective masks she needs to take care of patients with coronavirus. And she's not the only one. Multiple nurses contacted us with similar complaints. Complaints leaders at Catholic Health say are without basis.
My number one priority, and everybody in this room has heard me say this, is keeping our healthcare workers safe.
Dr. Kevin Shiley of Catholic Health says the company is, quote, absolutely following all guidance from the CDC and Department of Health when it comes to providing the proper masks for healthcare workers.
So we wouldn't wait, for example, for a test result before starting the personal protective equipment. It would be started immediately as soon as that suspicion was noted.
But the nurse, who did not want her identity revealed for fear of retribution, says that's not what happened just over a week ago on the 5th floor at Mercy, when a man with respiratory issues, who some nurses suspected is a COVID-19 patient, was not given a test.
These patients are not being tested. They have multiple symptoms.
Days later, she says the man died of COVID-19, but not before he was exposed to multiple healthcare workers not wearing masks.
The emergency room nurses are only allowed to wear a surgical mask. It seems like this corporate thinks that everybody's immune.
The mother of another nurse sent us a text message saying the Catholic health system is not providing them with masks. They are locked up and only given out when someone deems it necessary. Yet they are sending people up to the med floors without being tested because they have no tests. Dr. Shiley acknowledges that some ER nurses have been wearing basic surgical masks instead of these more protective N95 masks because the N95 is not always medically necessary.
Simply walking by someone in a hallway that isn't undergoing one of these aerosol generating procedures, that's not considered like a really dangerous risk in terms of needing an N95.
Health officials say they've been trying to conserve supplies for the later stages of an outbreak that currently has no end in sight.
If it isn't something that's necessary, and we know that we could help maintain an adequate supply of devices by not wasting them or overutilizing them now, that allows us to make sure that, down the line, as we climb this mountain of the epidemic, which it really is, we're going to make sure we're going to feel very comfortable that we have the supply available.
For the I-Team, Charlie Speck, 7 Eyewitness News.